Hello and welcome back to today's session. Last time we introduced the autonomic nervous system, identifying acetylcholine as the neurotransmitter for the entire parasympathetic system, the body's rest and digest break peril. Today we are focusing on the main locks ACH engages at the organ level, the muscarinic receptors M1 through M5. These receptors are where we apply most of our cholinergic drugs. So, the brake pad locks. You see muscarinic, okay, so it's pronounced as muscarinic receptors. Muscarinic receptors are crucial because they mediate all the effects of parasympathetic system on the internal organs. Unlike the nicotinic receptors we'll discuss later, muscarinic receptors are G protein coupled receptors. This means they produce slow, sustained and varied responses rather than fast electrical response of ion channels. So we have 5 subtypes, however 2 dominate the clinical pharmacology. M2 receptor. So it's predominantly found in the heart. Activation of M2 receptor leads to decrease in heart rate and force. The brake on cardiac system. M3 receptor, it's found everywhere else. Smooth muscles, lungs, GI tract, bladder and all glands, salivary, sweat, lacrimal. Activation leads to contraction, bronchoconstriction, bladder contraction and secretion, salivation, sweating. Muscarinic agonists. So these are the wet drugs. Muscarinic agonists are the drugs that mimic ACH directly and directly press the parasympathetic pedal brake. They cause an overactivation of rest and digest functions. So bethanechol. So this drug is resistant to breakdown, making it effective orally. It is highly selective for M3 receptors in the bladder and GI tract. It's used to increase bladder contraction after surgery or treat non-obstructive urinary retention. Or pilocarpine. So this drug is used primarily for its secretory effects to treat Sjögren's syndrome by stimulating saliva or tear production, and as an eye drop to cause meiosis, that's pupil contraction over here, and reduce intraocular pressure in glaucoma. Adverse effects are the sludge syndrome. Because these drugs globally stimulate M3 receptors on the glands, their side effects are largely related to excessive secretion and smooth muscle activity, often remembered by the acronym SLUDGE, SLUDGE. S stands for salivation, L stands for lacrimation, that's tears, U stands for urination, D stands for defecation, G stands for GI distress, that's cramps, and E stands for emesis, vomiting. Additionally, overactivation of M2 can also lead to bradycardia, that's slower heart rate. So, muscarinic antagonists. So, these are the dry drugs. Antagonists are the opposites. They block ACH from binding to the muscarinic receptors. They essentially cut the brake line, allowing the sympathetic system, that's the gas pedal, to dominate at the target organs. So the examples are atropine. So the prototypical muscarinic blocker. It blocks all M receptors. So it's used to treat severe bradycardia by blocking M2 receptor on the heart and to reverse cholinergic poisoning. Or scopolamine. So it's similar to atropine but has a stronger CNS effect. It's used to treat transdermal patches to treat motion sickness. And tropicamide. It's used as an eye drop. It's used to dilate the pupil for eye exams. The adverse effects, it's the anticholinergic syndrome. Since these drugs block the M3 receptors on the glands and M2 receptors in the heart, they give the exact opposite effects of the agonists. Dry mouth due to no salivation and difficulty in swallowing, blurred vision due to the pupil dilation and loss of accommodation, tachycardia due to increased heart rate, that's due to the loss of M2 brake, constipation and urinary retention due to loss of M3, smooth muscle contraction, and CNS effects, especially with drugs like atropine and scopolamine, leading to confusion and delirium. So, a classic mnemonic for high-dose anticholinergic poisoning is hot as hair, dry as bone, blind as a bat, red as a beet, and mad as a hatter. So, cholinergic muscarinic pharmacology is all about the brake pedal. Agonists like bethanocol push the brake, causing slow and wet symptoms, while antagonists like atropine cut the brake lines, causing fast, dry, and potentially confused symptoms. Next time, we'll move out of the organs and look at the neuromuscular junction as we cover nicotinic receptor pharmacology. Until then, keep revising.